I'm really excited to be able to show what we've been building and how we've been deploying it with customers. So with that, I'm going to pull up the screen that I have in front of me so that I can do a demo of a couple of the things that we've been talking about. So what you see here is what we're calling Marmot Home. This is essentially your one portal to all Komodo data and insights. What we really wanted to do was make it easy and accessible to get everything in one place. Now you can see spaces to ask questions, updates, recent work, but I want to focus on some of what you see on the left-hand side. So first, I'm going to talk about my map. What we really wanted to do was create full visibility into all of the data deliveries that you get from Komodo. Always know what you've licensed, when it was last refreshed or delivered. And as you can see in here, we've done a lot of characterization around it. So you get an overview of what data, what's the refresh cadence, inclusion filters. In this case, it's codes related to sickle cell disease, and also some stats on the data deliveries. What we wanted to do was externalize various data quality checks that we do internally to help you and your team separate signal from noise. So now let's move to another thing that you see here, Explorers. We're starting by launching 2 Explorers, Provider and Code. And the goal here was to give you the ability to explore what's possible with Komodo's healthcare map without having to file a ticket or a request for our team. With Provider Explorer, you can see the richness of our provider map. Multiple levels of HCO and HCP affiliations, addresses, specialties, academic versus community, and so on, validated from a variety of third-party sources, but also through our real claims data that reflects where HCPs are actually treating and referring patients. In addition, we have Code Explorer, which allows you to see counts across the entirety of the map, not just what you've licensed, but all of our 330 million plus longitudinal patient lives. And you can go in and see ICD-based definitions, HCPCS or procedure-based definitions, as well as NDC. So with that, I'm going to jump into Provider Explorer. So here you can see a nice map of the United States, Alaska, Hawaii, and we're starting with looking at HCOs. So I live in California, so immediately Kaiser pops up, and I can click through and I get this nice visual representation of the Kaiser network. While we know that a lot is happening in California, you can also see some of their satellite group practices in the Pacific Northwest, as well as on the East Coast in Pennsylvania and Atlanta. If I scroll down a little bit, while I currently live in California, I'm originally from New York, so you can see large presence in the tri-state area, as well as a bit in upstate and western New York. And let me click through one more, Cleveland Clinic. Again, a really cool way to see the networks of different HCOs and their geographic footprint in the US. So here with Cleveland Clinic and their many sites, both in the Cleveland area, as well as in the Southwest and in Florida, I can click through to individual locations. So here, the Cleveland Clinic Hospital in Cleveland, I can see it's an academic, it's a teaching hospital, what the address is, acute care. I can see it is owned by the broader Cleveland Clinic family. A really important part of our provider map is affiliations at multiple levels. And I can see affiliated HCPs, here presented alphabetically, but I can also filter by specialty. So now let's move over to HCPs. One of the benefits of having a common name is that I can search for myself and see lots of doctors that share my name. So here with Daniel Cohen, let's click through to the first one, a pediatrician in Purchase, New York. With here, I can get fast facts around the patients that are being treated by this doctor. I can see patient counts overall by year. Unsurprisingly, because this is a pediatrician, we see a lot of patients under 17. So you can see all of these stats around age, sex, race and ethnicity, and geography, where again, most are concentrated in New York and a few elsewhere. I can also, up here, see the affiliation. So this Daniel Cohen is affiliated with Westchester Medical Group, and I could click through and go back to that HCO. Again, multiple levels of HCOs, group practices in hospitals, and individual physicians. So really the goal with Provider Explorer and Code Explorer is to provide unprecedented visibility into our healthcare map. And with a provider map, you get unprecedented precision into the physicians and the ecosystems that they operate in. So let's talk about some other stuff back on the left-hand side. I'm going to click through to library. So The code sets and physician lists that you build in Explorers can then be saved as definitions. Here's how my company thinks about myasthenia gravis, or here's how we see the multiple myeloma market basket. These code sets become accessible in your library. We see here ones that are created by the team. We also see a pre-created, curated list of Komodo code sets. And the goal here is that every artifact you generate with a Komodo experience, whether it's a code set, a cohort, a methodology, a market basket, it shows up here organized and ready for your team or agents to use in a governed, repeatable, and transparent way. You'll also see over here apps. We're building a variety of out-of-the-box and custom apps that allow users to easily create and consume insights for specific use cases. Today, I want to talk about 2 apps that are already available for Marmot customers. The first is dashboards. This is for users that want to generate a dashboard leveraging an existing analytic, but with custom parameters. So you can specify what's your cohort, what's your market basket, what's the time frame, what's the washout period for lookbacks. It allows you to tap into new types of knowledge just by describing the population you're interested in with no technical background required. So you don't need to be a data scientist. You don't need to audit or review SQL code. You can just say, this is the population I'm interested in, this is the analysis I'm interested in, and go from that question to a dashboard in minutes instead of weeks. The second application, and what I want to spend a lot of time on today, is Marmot Navigator. Marmot Navigator is our agentic AI analytics solution, and it's for users that want to generate a report, whether a new exploratory analysis or build on an existing analysis or approach that their company has developed. Quickly gets you from a question to an answer that you can trust, explain, and repeat. And there are 3 really important factors that allow us to do that. The first is that we've built Marmot Navigator with an intelligence layer that has a deep understanding of our healthcare map. Not just the data products ourselves, but how to work with them. Things like coverage and lag, and when it's appropriate to use a projected data set versus when it's appropriate to use claims data. The second is around a deep understanding of healthcare analytics use cases and workflows. On the use case side, we're bringing in knowledge around everything from patient journeys, through line of therapy, through brand performance reporting. And on the workflow side, we built an AI harness that reflects how healthcare analysts actually work. All of the steps that you take, from defining the code sets and cohorts up front, sense checking if it's the right population, running the analyses, and ultimately reporting out. And the goal of that orchestration harness was to design with trust, transparency, and reproducibility in mind at every step. So again, the 3 things here are deep understanding of the healthcare map, deep understanding of your use cases, and a harness that was built with trust, transparency, and reproducibility. And so with that, I'm going to jump into Navigator and show a real analysis that we've done here. So what I decided to do is study HCP segmentation for MASH. MASH is metabolic dysfunction-associated steatohepatitis. It's a space that has had a lot of interest recently. There is a new drug launched, Rezdiffra, that is used specifically to treat this. A lot of the GLP-1s are being studied in this space, and there are a number of companies that have late-stage pipeline assets. So I thought it would be interesting to dive in and understand the market a little bit better. So here you'll see I started with a simple prompt. A lot of upcoming launch activity. I'm interested in segmenting HCPs. Let's just start by showing me the top 50 HCPs by overall MASH patient volume, NPI, name, specialty, primary HCO affiliation, and so on. The first thing that Marmot Navigator does is it builds a plan around that analysis so that we can align on the approach. So you'll see here it outlines what are the different steps that it wants to take, what are some of the rules that it will implement. The goal is to have something explainable and aligned on up front. Then I'm going to move over into our execution log. Part of transparency is we want to be able to show every step along the way. Here you can see the back and forth that I've had, but below you can see every single tool call that Marmot Navigator is making. From the code set tool call to build the code sets, writing SQL code to build cohorts and run analysis, the tools to generate the graphs, and the tools to write the reports. So you can really break it down at each level. Building on that, I want to click over here into our Files tab. So this is another element of transparency. Part of transparency is seeing the step that our AI agent takes along every way. But here, what is the code that underlies it? So you can see the code sets that are resulting from here. So Rezdiffra, well, what are the various codes associated with that drug? Semaglutide, what are the codes associated with that drug? What are the data filters that are applied? Some of the SQL code that I'll get into a little bit later when we talk about the analysis. But really important here is that you can dive in and you can validate, is this SQL code that I believe? Are these the code sets that I trust for the analysis that I'd like to run? You can also see this in an execution graph view. So for those of you that like to see data flows and low-code views, you can see how these steps are interconnected, not just the files themselves, but how they pull from one another. So here you can see the MASH diagnosis events is our first filter, and then you can see how that flows into SQL code to identify the patients and the various analyses that flow below. So that's how it's operating, but let's jump into the reports and see what it's come back with. So here is an early version of the report that was run, top 50 HCPs treating MASH. As you can see, I have a detailed cohort summary that breaks down the patients that I'm looking at, the HCPs, and then I get this great list of top 50 HCPs treating MASH, their name, specialty, city, primary HCO, a little bit of a callback to our Provider Explorer and our provider map. This is leveraging our HCP and HCO affiliations data to say what is the HCO that that physician is affiliated with. And we can see their MASH patient counts. Now, one thing I notice as I'm looking through here is I've got a bunch of different specialties. I have hepatologists, I have nurse practitioners, I have some surgeons, some pathologists. So one of my follow-up questions is I'm really thinking about the drug treatment dimension of MASH. So I ask a follow-up question, can we refine this to focus on specialties that are relevant to treating patients or referring them to treaters? What you see here in the upper right is I have various versions of the reports that have been created along the way. So I'm going to jump up to the most current version. Marmot has taken that request and it's built logic on top of it, again with that plan and execution at every stage. So now I've been able to segment out into treaters versus referring or co-managing HCPs, and it's updated the list of 50 HCPs, where I now see it's removed some of the pathologists, it's removed some of the surgeons, really focused on who is treating and referring these patients. So again, this is interesting. It's broken out patient count. I've got some visuals below showing me the specialty mix of these top HCPs, geographic distribution, unsurprisingly, a lot in California, Texas, Florida, and so on. But there's some other questions that I want to ask. I want to go even deeper. So I know that right now we have Rezdiffra, we have semaglutide that's being used for it, and some other GLP-1s that are studied. And a lot of those GLP-1s have other indications that they're used for. So I wanted to understand for each of those HCPs, what percentage of their patients have a comorbidity that might influence prescribing by a GLP-1 versus non-GLP-1 therapy. And you'll see Marmot builds out a plan. So what percentage of their patients also have type 2 diabetes, also have obesity, heart disease, high cholesterol, and so on and so forth. And you see here below, I get a great chart that goes even deeper on these HCPs. So for the full MASH cohort, what percentage of patients have these various comorbidities? For the top 50, what does that look like? And then for each individual HCP, I can get down to this really micro segmentation that informs how I want to engage with them. And while you'll see there's a lot of overlap, there actually are some striking differences. Some physicians where type 2 diabetes is in the 20% range, others where 80% or more of their patients have that condition. And this is really important if I'm trying to design a segmentation strategy or if I'm trying to work with my field team and tell them, here's how you should be engaging with different physicians and here's how we should think about different pockets of opportunity. So that's an example of one analysis that I did that was really focused on the patient population. What's great about Marmot, though, is that I can build on it. So here I've opened up another chat on provider behavior. For the top 50 HCPs, I want to classify them into 3 archetypes. 1 being treaters, 2 being referrers, and 3 being latent population. Again, if I'm thinking of my launch strategy, this kind of segmentation based on real-world prescribing behavior is super important for how I set up my strategy and how I engage with my customers. The nice thing is that even though I've opened up a new chat to do this, it's building on all of the analyses that I've done before. So it's able to refer to the files that already exist, the definitions that we have aligned on, the top 50 HCP list that we've done, and go deeper on it. And so if I scroll down here, I can see that it's done the archetype classification. I'm actually going to jump into plan because I think there's a really cool thing here where it's showing the logic that it is using. Now, I asked for treaters, referrers, and latent population. I didn't give specific business rules. I could have if I had them. I could have instantiated them as the method that I like, but I used Marmot as a thought partner of how do we want to think about this. And it outlined, well, we're going to want to look at a couple of things. We're going to want to look at their prescribing rate. We're going to look at whether they're the prescriber. We're going to look at whether they're staging patients. And based on those values, create some cutoffs. And I had the opportunity to align with Marmot on what those cutoffs look like. In this case, 10% for treating, 15 to 20% for staging, and so on and so forth. So jumping back to the report, Marmot has used this to classify the HCPs. What's super interesting is I have these top 50 HCPs, but only 7 of them actually fall into the high treatment archetype. What I'm seeing is that there are a lot that are referring out, and there are a lot that are actually just sitting on MASH patients and aren't doing the proper staging that would determine whether they're treatment eligible or referring to centers of excellence where they can receive the treatment that they need. So now I've gone from, at the beginning, a simple question around who are the top 50 HCPs to a lot of striking insights that are going to inform my launch strategy and inform my execution strategy with the field. What's also really cool is I could also come back here in a week or in a month and continue the conversation leveraging all of the same files and definitions that I previously had. So when I think about a launch that is dynamic, I want to come back and I want to see how those prescribing behaviors have changed. If a new drug launches, I want to start incorporating it into my market basket. I want to see what's happening with customers. Where am I having success and where am I not having success? And what's great is that Marmot gives me the ability to do that reproducibility and get that consistent answer with an agentic AI tool.